Hi there and welcome to this video. So in this video today I'm going to introduce you and explain to you about sciatica and what can be done about it and how I can help you. Hi, I'm Dr. Surinder Sandhu, Doctor of Chiropractic. I'm the chiropractor at Bedford Chiropractic Clinic and the owner, and I have had over 25 years experience. So if you're looking for an experienced chiropractor, look no further. I've treated well over 30,000 patients and actually physically completed over 130,000 plus adjustments on my patients. And I can potentially help you with sciatica. So what is sciatica? Let's address that first. Sciatica is this pain that you might be experiencing right now at this minute, or have certainly experienced possibly in the past, of this pain that sort of originates in here from the lower back and then comes all the way down and follows that sciatic nerve. Now the sciatic nerve consists of about 4 nerves that come from the lower lumbar vertebra and the upper sacrum, and then they form these 3 nerves that run all the way down into your big toe. And you may be actually feeling some pain at the back there. That is your classic sciatica. You may actually have some pain here in your buttock as well. You may even have some pain radiating all the way across there, or you may have some pain down here in your sacrum, maybe in your coccyx as well. But the main issue that you're getting is this pain running down the leg. If you want more information about this other pain up here or down here, then watch one of my other videos on back pain. But today I want to talk to you about the sciatica. So what causes sciatica? Well, there are various reasons for how sciatica can occur, and it's all to do with basically the discs and the vertebra in your lumbar spine. It can also have to do with your muscles as well. And there are 2 muscles in particular that are involved. One of those muscles is the big psoas muscle here. In fact, I call it the low back pain muscle because this is actually one of the main muscles that gives the majority of people back pain. Why? Because it is the longest muscle in your abdomen. It is the only muscle that attaches into the discs of the lumbar spine, and it attaches all the way down into your hip joint as well. So it can give you hip pain, it can give you groin pain, and obviously it can give you back pain because it can create instability in your back. Now, the other muscle that can also be blamed or can be part of your sciatica is this muscle here called the piriformis muscle. The piriformis muscle is one of the external rotators of the hip joint, and the sciatic nerve, as you can see, comes down here and comes either over, through, or under that muscle, and it runs then all the way down the leg. And the sciatic muscle, the piriformis muscle, is here. So it's like a triangular shape right there. And as you can see, the sciatic nerve will pass over, through, or under. And that is definitely a muscle that can cause low back pain. And that is your classic sciatica, that horrible pain that you can feel down here. It may end here, it may run all the way down into your big toes. Obviously, sort of running down into your toes is not ideal because that is now really inflamed and angry. Now, how can it sort of occur? Well, we spoke about the 2 sort of muscles. Let's talk about the discs now and how they can affect you. The discs are these wonderful sort of washers that are separating your vertebra, and there's 5 of them in your lumbar spine, and these 5 are numbered 1, 2, 3, 4, 5, and then you have the sacrum. So when you hear 3 and 4 or 4 and 5, that's actually referring to one of the lumbar vertebrae. You have these sort of discs, and the discs are beautifully shaped. They're very, very strong with these concentric rings, and then you have this middle portion here, which is like the cushioning. So I describe it like a donut, because when you get a tear in the dough, what then happens is the jam begins to leak out, or in this case, the nucleus pulposus begins to leak out, and then it can come out in various directions, normally towards the back of the vertebra. And it can either come straight out like this and encroach into the vertebral canal, spinal canal, or it can actually come out and encroach into sort of the side space here where the nerves come out. And obviously neither of those are good. It can also just get a tear initial tear in the vertebral disc as well, and that can create quite extreme localized pain in your vertebra. So, what can be done about it? There's quite a bit that can be done, all right? The operation is always the last resort. So if you've been offered an operation, please give us a call today. Let's get you seen, because there may be an alternative that I can offer you. Now, it could be that you are at the stage now where you've left it, or the disc is so badly damaged that the operation is the last resort, but I can assure you it is the last resort. So give yourself the opportunity to find out if I can help you first. Now, sciatic pain is terrible. It's this gnawing sort of pain. It can be sharp. It can give you pins and needles. It can give you tingling. There's no escape from it. You can't seem to find a position that sort of relieves it. It obviously disturbs your sleep. It disturbs you during the day. Getting up and movement can be exceptionally painful. If you are experiencing any of that at the moment, then please don't. All right? Give yourself the opportunity to find out what it is that is the underlying cause of the problem. And that's the important factor here that I want you to bear in mind, is that what I will do is I will look at the underlying factor of why you've got that pain. Taking painkillers, sort of just waiting for something to happen, is not going to fix the underlying cause of your pain. But that's what I do. I will help you to understand what's going on and help to find out what's going on. Then we can actually help you to resolve it. And there's a lot that can be done. The first thing that we have to do is we have to take that pressure off the disc. We have to take that pressure off the disc, and we have to get the joint moving again to try and sort of alleviate the inflammation that is actually causing that horrible sciatic nerve pain. So that's the first thing that we're going to do once we find out what is actually causing it. And then we've got to look at sort of the ergonomic sort of issues as well. Like, for example, what is it that brought it on? Was it some kind of trauma? Was it a road traffic accident? Was it a sporting injury? Was it something that chronically built over time because of the way that you're sitting? Are you using sort of a back support? Are you using something to support your spine? Are you sitting correctly at your computer desk? Are you exercising properly if you are sort of a person who uses the gym a lot? So all of these factors will be taken into account to help you understand sort of what's happening, and then I will be able to help you get rid of your sciatica. All right, so if you really want to get to the bottom of it, resolve it for long term, not just short term, then give me a call today. Dr. Sandhu, Bedford Chiropractic Clinic, the most experienced chiropractor in Bedfordshire, and I am here to help you. So give me a call today. The numbers are below, and I look forward to helping you. Because remember, there is no greater wealth than health. Don't be in pain. I look forward to helping you. God bless you. See you soon.